I sort of linked it in this episode to RF Microneedling as like the Taylor Swift of the now. It's the it girl, it's the global superstar, right? Like it just works. It's amazing. The results are natural.
This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Welcome back to a brand new season of Med Spa Mayhem. I'm so glad you're with me on this journey. If you've been following along, you'll know I've been interviewing all sorts of people about the aesthetics industry. I've spoken with doctors and other providers about their favorite treatments and also what to avoid. We've heard from a few patients who have had some really bad experiences, and a couple of lawyers have weighed in on the legal aspects. As you can see, I'm on video now. Today, I'm speaking with Dr. Judith Borger about our mutual favorite treatment, RF Microneedling. When we met last time and she interviewed me about my book, we discovered that we both have a passion for the same treatment. So today, you'll hear all about it, how it's done, what it's like to have it, what it does, and what the expected outcomes are. I really hope you enjoy this discussion. And as always, if you have questions, if you have a story to share, if you have a topic that you'd like to hear on the podcast, please drop me a line. The contact form on the website, medspaamayhem.com, goes straight to my author site and straight to my inbox, and I get those personally. So please reach out, and I hope you enjoy this interview. Hi, this is Dr. Kate D, and I am back today with Dr. Judith Borger. Dr. Borger is a mom of 3, wife, board-certified physician, successful business owner of both the aesthetic doctor and concierge medical art. Her concierge practice is located in Fayetteville, North Carolina, offering a full spectrum non-surgical medical aesthetics centered on the individual patient and their experience and goals. The aesthetic doctor encompasses the podcast, The Aesthetic Doctor, as well as courses, life, and business coaching. Thank you so much for coming back today, Judith.
Hey, it's so good to be here and actually to be back as an actual guest versus a host takeover like we did.
I know, yeah. That was fantastic. And today I was hoping we could talk about our mutual favorite procedure, building collagen with RF microneedling, which hands down is my favorite thing to not only really perform, but to have for me. How about you?
I agree. I mean, I think one of the really great changes I think that's happened in aesthetics over the last couple of years, I think, is that instead of chasing the individual wrinkles and the individual volume loss, is that we're looking at the face globally. And we're really realizing that collagen and elastin loss happens in the entire face. So that really procedures that give you the most natural and best global anti-aging benefits really address some of the root causes of why we feel like our skin loses elasticity, has less volume. And we've talked about this, and we're going to talk about it for your audience, is like collagen loss.
Yeah, our skin, actually, not just the face, the whole body, all the skin loses collagen over time. And what I try to educate people about is that by the age of around 30, your fibroblasts, the cells inside your skin that make collagen and elastin too, those go dormant and then they don't make anymore. And your body breaks those things down at about 1 to 2% per year. So from around 30 on, you're slowly losing it, right? So your dermis, your skin is slowly thinning. And as it does, it starts to retain the wrinkles and over time starts to sag. So my number one thing is to, well, hopefully get you around age 30 and get people to start doing something to prevent that loss. So keep those fibroblasts awake And that can be, there's several options. I think my patients in their 30s often will do microneedling or sometimes non-ablative laser resurfacing. But as you go older, especially if you've already lost a fair amount of collagen, to build it back up, there's nothing better than RF microneedling, in my opinion. What do you think?
Yeah, so I mean, I completely agree. And I have a podcast episode on RF microneedling, and I linked it in this episode to RF microneedling is like the Taylor Swift of the now. It's the it girl or star, right? Like it just works. It's amazing. The results are natural. I would say that if I could have everything, I would probably combine RF microneedling with Sculptra, not necessarily at the same time, even though I know people are studying that, but really do both RF microneedling and Sculpture for that extra oomph and maybe that extra volume that we lose in that lower face as well. But as I said, if there was only one thing, I agree with you. RF microneedling, it's the it girl of aesthetics. It's what I would choose every time.
Yeah, and I totally agree. And I also agree with the addition of Sculptra. We've been doing for many years now a series of treatments that involves both. That years ago I started calling the glow lift. This is kind of before people were doing this more commonly, and we can get into the details of why you would choose to do Sculptra or not. But let's talk about RF microneedling first, and what is it and how does it work? And then we can move on to other things that build collagen and Sculptra. How about that? So
Sure. I'm
can you
so
describe for our audience basically what is RF microneedling and how it works?
Yeah, absolutely. So let's kind of start a little bit with just microneedling because that's another way to stimulate collagen at a like less deep and less good way, but we'll describe the microneedling part of it first. So basically microneedling having tiny needles, and what they do is they kind of most of the time we do little circular motions or back and forth, and the idea is that you do controlled damage to certain parts of the skin, and your skin then basically rebuilds that, has a whole inflammatory and wound healing and fibroblast response, and then rebuilds it and wakes up those fibroblasts. And fibroblasts are the things that the builder of the collagen that you mentioned in your introduction start kind of going to sleep and are less active. And then as a result, you get this better improved wound healing and skin healing. So that means if you have some acne scars or skin imperfections, some pores, you're just going to get that skin like rebuild in a very controlled kind of damage fashion. We're not overwhelming the repair response. We're just doing enough damage that we can kind of rebuild what we have and hopefully add a couple more collagen fibers. And I think the other thing to really mention for your audience is that it's not necessarily just about the amount of collagen. When we look under the microscope, what really matters is how what we call is like the collagen is organized. So in very young, very healthy, very vibrant skin, where the fibroblasts are very active, which are also not only the builders of collagen, but also the maintainers of collagen, then what you get is you get what we call very organized kind of collagen fibers. So they're in this beautiful pattern. They're organized. There's lots of them. And then as we age, not only, like you said, do we decrease the collagen in a gradual slope down from age about 30 to however long you're lucky enough to live, but the collagen that you have also kind of looks messy. So when we think about it, like a good sort of visual for people to use, because I love visuals, is that if you think about like you're knitting a sweater, right? And when the sweater is beautiful, like it's super tight, like little loops. And then as it gets stretched out and holy, and you've washed it 300 times, and your thumb has made a hole into it, and your cat has pulled on it, like that sweater strings, they're not that beautiful anymore. And that's exactly how like older people collagen looks under the microscope. Like the technical term for it is less organized. But it's
Yeah.
really that idea that not only do you have less of it, but it's not arranged in those nice tight little rows. that give you that beautiful, even skin, but it's kind of just a little floppier and all over the place. So that's microneedling and collagen. What radiofrequency does when you combine it with microneedling, so what radiofrequency microneedling does is we still have the microneedles, except for now we don't kind of just use the mechanical force of going them around in the circle. Most of the devices, you put them on the skin, you push the button, and in like sub-milliseconds, the needles go into your skin. And as they're at whatever depth we set them, we deliver a controlled pulse of radio frequency at depth. So what radio frequency does, it's really interesting, is that at depth, again, it partially denatures collagen. So same thing, a lot of this is really calling on your own fibroblasts, on your own healing response to make things better, tighter. So again, by using that ball of yarn, essentially, and totally undoing the sweater, we're giving our body the chance to re-knit it beautifully, if we're thinking about it with that same sweater example. Whatever collagen strands and fibers, we denature them, which is the way as in we injure them. And then again, we're relying on your own fibroblasts and your own skin response to make that collagen more beautiful. And in that same time, that stimulation of both collagen, elastin, and hyaluronic acid that we actually see with radio frequency, we're getting rebuilt, more beautiful, tighter skin with more collagen. Of course, there's different depth that we can put that on. Of course, if I go on a forehead, I'm going to go fairly superficial because we have not as much room. And then, of course, if I have, let's say, a lot of laxity or a lot of looseness for those lay people on my neck, then I'm going to go deeper. I can deliver more radio frequency. But the idea is that we're getting both the skin response with the microneedles and then also using the microneedle as a way to deliver radio frequency at depth. And radio, again, helps denature collagen, which then will unheat the tissues as well, which induces your own healing or repair response to make everything like it was 10 years ago.
Yeah, that's a great description. I love the analogy to a knitted sweater. It's a really nice picture that I can totally see in my head. Hopefully that's helpful for people. I think that to point out that the big difference between regular microneedling and RF microneedling, we're talking about several orders of magnitude difference in power and effects and results. So with regular microneedling, the amount of damage you're creating with these little needles is essentially pretty minimal. And we're relying on creating little channels through your epidermis down into the dermis. And in my practice, we use either a growth factor serum or exosomes that will go in through the channels and stimulate those cells to turn on and make some collagen for you. It's not a lot. Okay. It's a chemical, it's a hormonal signal essentially that says, hey, turn on, make a little collagen. Whereas with RF microneedling, you're going in with RF energy. And what Dr. Borger means with at depth means that these needles, most of the devices that we use, and certainly my device, and it sounds like yours as well, use insulated needles, which allow the RF energy to be delivered only very specifically at the depth of the tip of the needle. And it's that way very safe because if you could use a top-notch device, you can control that depth very precisely. So it's not too deep, meaning it's not going to touch the fat that's in the face, which we really want to preserve. And it's not too superficial, meaning it's not too close to the surface, meaning you're not going to mess up your epidermis with it. And most of the downtime that people see with lasers and other kinds of energy devices has to do with the damage to the surface of your skin, not inside the skin and the dermis. So we're able to have this very controlled, focused damage just in the dermis, and that triggers kind of a massive amount of collagen and elastin, as opposed to the sort of like somewhat minimal amount that you get with regular microneedling. So that to me is like the big difference.
And I love that you honed in on that for our audience because you're absolutely right. It's magnitude different. I don't want it to be like we're doing 1 versus 2. It's like we're doing 1 versus 1 plus another one that's 100 times as effective. Again, we use the insulated needles because some of the big downtimes or some of the big complaints that people have with other devices, like you said, you mentioned two of them are getting those marks of hyper and hyperpigmentation if the radio frequency is almost too close to the skin or the epidermis or the surface of the skin. So you're getting that heat and that temperature, not deep, but superficial. And then you can get the little pattern of the needle. Or like you said, going way deep and destroying fat. Now, there's some times that it has a setting where in, let's say, the body, the jelly roll of the butt, we actually have settings where we intentionally destroy fat. But that is not what we want to do in our face, because actually some of that lower fat, once we lose it, like we see with Ozempic face and things like that, it gives us a lot of hollowness. It gives us a lot of kind of a look of not usefulness.
Yeah. And I do think that is a concern that I know we've been asked about. Will this hurt the fat on my face? And the answer to that is in our hands, no. It's the device we use is very well calibrated for depth. So we're not going to go too deep and we're not going to go too shallow. And the other thing is it has to do with the person who's doing the procedure. And if you have somebody who's really not trained, doesn't understand the physiology of the skin, there are a lot of people in aesthetics who are not medical who don't really know this. And interestingly, there have been studies more recently looking at ultrasound measurements of the thickness of the dermis in various parts of your body, various areas of your face. And it's actually ranges more than most people think and is much thinner than people realize. And so there is a very real possibility that if you go too deep in various parts that you could damage the fat. So you really want to go to somebody who knows what they're doing and really is an expert in providing that kind of service.
I agree. And the one thing, two things I wanted to add, if I may, is number one, I think that is just like what you said. Deeper isn't always better. More aggressive isn't always better, right? So we know exactly, it's more about the precision and the targetedness and to deliver the right energy into the right tissues. And then another thing that is really coming now with a lot of the newer devices is that you actually get real-time impedance monitoring.
Yeah,
So,
I was about to mention that because our device as well. And basically what that's doing is measuring how the skin has reacted to the RF energy you've put into it. And you can tell when the impedance has changed enough, you're done, you can move on, right? And that's really helpful and has really changed. There are so many more RF microneedling devices on the market now, and a lot of them are good. There's kind of a range. The very first one I bought was almost 10 years ago now. So they've been around a long time, but the improvements in them has been really remarkable. So I would say also in looking for a provider, also look for someone who's using a really good device, one of the newer ones that measures impedance, and definitely always have an insulated needle. There's a really popular device that has non-insulated needles. I don't really like that machine. Then I think that is really super dangerous. And anyone with darker skin, absolutely not. Anyone with medium skin, no. Anyone who's Asian, no. So it's like there are a lot of people you can't use that machine on it. I think people who own it don't necessarily even realize that until they have a bad complication. But the thing that's fantastic, though, about these devices is that it truly will thicken and tighten your skin. And in my practice, we typically will combine the treatment immediately after. We'll do a non-ablative laser resurfacing. So you can really incredibly rejuvenate the skin in a very significant way. I mean, our recommendations, I'm kind of curious to know what you tell people. My recommendations is really for skin tightening. We generally recommend one treatment per decade of life that you've lived. And when I first did it for me, it was the year I turned 50. And I hired my first injector who worked for me and I taught her how to do it. And we did 5 treatments that year because I was turning 50. And it's a very slow improvement. It's not immediate because you're relying on your little fibroblasts to get going and make collagen. And it takes them many months to do that. typically people will start to see results. Some people say they see results after the first treatment, but that's really early. I think that I really could see a change maybe by 5 or 6 months. And then at 1 year, when I had my like big 50th birthday party, and I'm from the East Coast, I live here in Seattle. So I had a few friends coming out for that, and they hadn't seen me in a while, and they're my age, and they're like, whoa, you look great. What are you doing? And I'm like, oh, this stuff really works. I swear to God. So it's pretty cool. So it is really, in my opinion anyway, the one treatment that we have that really does thicken and tighten the skin. And you can actually see that, but it takes a very long time. So I usually tell people, oh, give me a year. Okay. So first of all, if you're 50, it's going to take a while to do this. We usually do them 1 to 2 months apart. So it takes most of the year to get that done, right? And then your results will keep evolving over the next 6 months after you're done even. What kind of guidelines do you recommend in your practice?
Yeah, I mean, I think, we normally start with a series of 3. Again, there is a lot of things we ideally would love to do, and at least where I live, I'm not in Seattle. I'm in a medium-sized town that's probably below the national average in income. So, as I said, ideally, I say let's do a series of 3 and then let's do one every 6 months. And of course, if you're older, we might want to do more ahead of time. But I also am practicing in a climate, and I try to always be very mindful of the budget that people have and the ability that people have to spend on that treatment. So as I said, I think your recommendation is spot on. We generally ask people to start at least with a series of 3. And the nice thing is by the end of that last series, when we then do the first follow-up, then they are seeing results. I do think there's a little bit of a biphasic nature to the results, because to the fact that you do get the microneedling superficially, they're getting a little bit of a glow. They're getting a little bit tighter pores. They're seeing that initial glow, and I think that's enough to kind of get them through the next series. But then you're absolutely right. To really get true tightness, to really get your fibroblasts to do what they're doing, it's gonna be 3 to 6 months. And that's what we tell everybody. So the nice thing is by the time they're like on month 4, meaning that 1 month follow-up from the 3rd procedure, after 4 months, they're starting to see that. But then about 3 months after, at 6 months, we're really seeing the best results. And you're right. Ideally, I love your recommendation of one treatment for every decade of life. And again, we are also obviously being mindful that what I would ideally love to do to your face might not necessarily be in your budget right now.
Yeah, and I have a fair number of people who will do 3 this year and 3 next year. And I do think that basically what happens when you do a procedure like RF microneedling, your fibroblast gets stimulated for about 4 to 6 months, and then they go back to being dormant. So really, ideally, you would do your next procedure before they're dormant again. Generally, I recommend before 4 months, because really they start to peter off, and at some point they are done. So I like to build on what we've done. And so if you rev them up and you get several months of collagen out of them, then you rev them up some more and then some more, then you're maxing out your results. So ideally, if you did it at least within 4 months, then you're going to it's going to take longer. That's fine. But you're still going to get your kind of maximum results out of your treatment. And that way, that's 3 a year. So you can go every 4 months and then do it again next year. And then since I'm 56 now, that would probably be what I would do now. But I've continued to do that every 6 months for maintenance. And so far, so good. I don't wear makeup. So what you see is what you get here. I would love to talk a little bit about Sculptra and how that's different and also complementary to RF microneedling, because I think that Sculptra is a really great tool to build collagen as well. And I do not use hyperdilute radius, which people are using now as an equivalent to Sculptra, another biostimulator. But I would love for you to explain to our listeners, what are these things and how do they work?
Yeah, absolutely. So first of all, like I am just an like such a fan of Sculptra. Like I have said, I want my face to be made out of Sculptra. And I think if you've ever seen Shina Bay, I mean, I feel like he's now getting a little old or maybe not has the aesthetics anymore. But for the longest time, like he was just never aging and he credited it all to Sculptra. Um,
Interesting.
but anyway, so you know what Sculptra really is, it's made out of something called PLLA, which is a poly-L-lactic acid. And basically what these particles do is these make like framework for the collagen to grow, and then the collagen replaces them and grows into them. Sculptra was originally developed for temporal wasting, meaning those temporal skeletal hollowness that we saw in AIDS patients.
Yeah,
And
so Sculptra was originally FDA approved in the 90s when people were having a lot of facial wasting from HIV/AIDS, and it pretty quickly got used for everybody else who wanted to look younger because it was really quite effective.
yes, what we do with Sculptra and what I love about Sculptra and the same with hyperdilute radius is that it does kind of two things. It does stimulate your own collagen and some tightness, but because it adds a substance that provides a framework almost like a around which we build new collagen. I don't know how many of you are like watching this on video versus audio, but like I have a very long, narrow face and I exercise a lot. So I can easily look very gaunt in my lower face and my temples. And I'm sure you can kind of picture that person. I mean, I don't look skeletal, but a great example these days and a great new market for that is all of the people with the Ozempic face were
Yeah.
suddenly lost so much volume that their lower, especially the lower face and the temples look so gaunt. So what Sculpture really does is not only does it stimulate new collagen, but because you essentially like inject like a new sort of a stimulating matrix, you can also subtly replace volume. Now, this is not a filler where like with hyaluronic acid fillers, and again, you know this, but I just want to explain it to your listeners. We kind of inject the gel, and where the gel is, the gel stays. It's more like we hyper dilute the matrix, and we like I love to use a cannula for it, and we like cannula it into the lower face and the temples, and then that matrix gets replaced with it's almost like a scaffolding for new. And so not only do you get more protein, but you get very subtle volume in a natural volume. It's not like a filler that it gets absorbed. It's your body building new collagen volume in places where it's lost volume.
Exactly. And totally agree with you. What you bring up, I want to mention just I'm very selective who I recommend Sculptra to. It is a little bit volumizing in a kind of general way. And I think it's perfect for people who are not relatively thin. They've lost volume in their face. It doesn't mean their skin looks all saggy or anything, but someone like you're the ideal candidate. I definitely have a rounder face. I have not lost a lot of volume in my face, and I generally don't recommend it for people who already have a very full face. So patient selection for me is very important, but it is fantastic for adding subtle volume and lifting and building collagen kind of in and under the skin. And it also takes months to show results of that and build over time. I will say with Sculptra, it continues to work for 1 to 2 years. It's very long lasting. And when people ask me about, well, how long do the results last? Well, when you're building your own natural collagen, then yes, your body will break that down at 1 to 2% per year. But that means that once you've maxed out on what the collagen buildup is from this treatment, then over time it's going to slowly dissolve away like any other collagen, 1 to 2% per year. But in a year, that means like 98% of it's still there. And that contrasts very greatly with filler, where you put it in, and the moment you put it in, at least all the filler we use is hyaluronic acid filler, the body starts breaking that down. And in a year, pretty much it's gone. I mean, there's some examples of when it's not, but basically, it's a very temporary thing. Whereas with any of these methods where we're building our own collagen, we're actually building something that's very long lasting.
Yeah, and I completely agree with everything that you said. We do exactly the same with patients selection. Probably also one of the reasons I love Sculptra is because I have the perfect Sculptra face, right? And I'm like 2 treatments in. I just got my second treatment about, I don't know, within the last month. But again, like it's like people like me, and we do have a large weight loss population. I think when choosing which of these modalities am I going to use on a patient, even though I do think like everybody could use RF microneedling, and especially having an insulated tip, I think the other thing we should mention is that with an insulated tip, you can really use all skin types, all
Yes.
ethnicities. And I was part of an FDA study for a device. And one of the things we actually saw, which we presented at ASLMS, which is the biggest sort of like laser science congress in the world, is the fact that we actually, other than not having any mens and any hyperpigmentation, especially in the darker skin type, we saw an improvement in dyspigmentation just from the idea that a lot of the hyperpigment and melasma and things like that are actually signs of damage. So if you erase or heal some of that underlying damage, it's not what we were looking for because we were measuring for tightness and collagen. But one of the interesting side effects we saw that we presented was actually this improvement in pigment and the skin brightening, which intellectually with an insulated tip and where some of that dyspigmentation lives in your skin makes a lot of sense, right? And one thing, because you say that about the sculpture, the sculpture or the collagen stimulation, how long it lasts. What I just tell people is if you think of the collagen loss as like a downhill slide, what we're really doing is we're kind of helping you bump up on your own slide, right? You're going to slide down your slide. But what I can do is make starting points back to maybe how your collagen looked 10 years ago.
Yeah, absolutely. It's very effective. And I think that there are a couple other things about it that people should know. So one is it does actually improve your skin. It makes it healthier. Some people worry, oh, if I have that, what if I wanted to have a facelift or something down the line? Actually, it makes your skin much healthier to have that done. It's easier to sew and to deal with. I don't know if everybody listening is old enough to remember Joan Rivers or who she was, but she had a lot of plastic surgery. It was pretty well known. She was not quiet about that. But by the end, when she was quite elderly, she had just very paper thin skin. You could kind of almost see through it. And that's much harder to deal with than surgery, much harder to sew. It's more friable, it's more dangerous. It is not harmful for actually having surgery in the future if that was your goal someday or you wanted to leave that open. So that's not really an issue.
I mentioned that, and I always tell people exactly the same thing because, we've all seen those people, and I love that you mentioned Joan Rivers, but where their wrinkles in their face have been pulled, but the skin doesn't look good, that if you have beautiful skin that get pulled, it will give you a much better and natural look even than if that old Florida lady like wrinkled skin.
Yeah. I
my
have to
God.
say also, my goal in life is to make it so hopefully nobody needs any plastic surgery. Because if you do this stuff kind of early enough, you're not going to need it. Because you can keep your skin, you can keep the collagen you had, especially if you start at the age of 30 and you do, say, microneedling 3 times a year. You're going to keep the collagen you have and it's going to stay pretty tight. You want to keep your skin tight and thick. And even if you start at almost 50, like I did, if you do this RF microneedling series, then you can build that back. And for the most part, it's not going to be like you're not ever going to age again. That is just not what we can't perform that miracle, but we really can set that timeline way back. And so you can actually prevent that loss and prevent that need for, nobody needs plastic surgery, but the laxity that compels people to look into that. I think that we can prevent that these days.
And I feel like you should also want to starve off your facelift for as long as possible because from what I understand, you get one good one in your life. And then after that, there's adhesions and there's scar tissue and all that stuff. So like, again, the more you can do to maybe only need that facelift at 60 or 70, then it's going to last you the rest of your life. If that's what you choose to do, ideally, we hope you don't ever want one or need one. But I do tell that to my patients regularly that one of those goals is also to kind of be able to be at a point where you can hold off of that. Obviously, as science and technology advances, who knows how good we're going to get with this, but it definitely is like as
Well,
close
it
to
does.
as we're getting right now.
Yeah, it does keep getting better and better. Certainly in the last 10 years since I've been doing this, it's just been remarkable. So if somebody is going to have, I want to describe what the experience is like to have RF microneedling. And so what do you tell patients about what the experience is going to be like?
Yeah, we of course do the thing that we go through their history because there are some contraindications to RF microneedling. Most of them are things like that they can actually have like pacemakers and things like that because of the radio frequency. And so we do look at their health history, especially we do have some patients too that are immune compromised or on some medications. But let's say we clear all of that and we've taken the pictures. What we do is we clean their face and then we use a topical numbing cream that we put on for about 35 minutes. We use lidocaine, tetracaine compounded. It worked really well. After that, their whole face will feel pleasantly numb. We again clean their face and then we work top to bottom for us because again, everything is globally connected. One treatment for us is from like your hairline all the way to your neck, because that's another thing that as we age, a lot of us like see our age in our jawline and our neck. And I feel like in necks, we've seen just the most incredible result. Maybe also because there's not so much other stuff that people do to their neck.
Do you always do the neck along with the face? Do you require them to do that?
You
Because
don't require them to do it.
yeah,
Listen, we price one treatment to be face and neck because, as I said, in my experience, I have found that a lot of people, if they already see laxity, they see laxity in their jawline and their lower jawline. And at some point, they are seeing changes in the neck. Now, if
well,
someone,
I agree totally. When I first started doing this 10 years ago, I did not talk about the neck as much, and some people wanted their neck done, others didn't. And I was like, okay. And then, but what happened over the years was I had people who had done their face and hadn't done their neck. And after a few years, they're like, oh my gosh, I wish I had done my neck. So now my face looks great. My neck is behind. And now we almost always do the neck as well, unless potentially if it's a young person doing
yeah.
it for acne scarring or something like that. But yes, it's really important that your face match your neck. I think that's really critical. And even if your neck doesn't show a ton of change yet and you don't like certain areas, I do think that doing both at the same time is really the way to go.
And trust us, people, for somebody like Dr. D, who's just turned 50 and I'm 44, like you're going to
Well, thanks that you called. I'm
collagen in your neck now.
yeah, and I am 56 and yeah, not 50.
See, that's what I'm saying. Trust us. Definitely.
I started doing microneedling, RF microneedling when I was, I believe, 49. Yeah. So it was that year that I was turning 50. But now, yes, I've had many treatments and I do about once every 6 months now. And if you're really interested, if you go to my spa website, Glow Med Spa in Seattle, I posted on our RF microneedling page. There's a whole video of me having one done before, during, and after, and then a day later. So you can see what it looks like. So do you use a Pronox at all during your procedures?
Yes, we have Pronox available.
Yeah, we do as well.
So first of all, our patients in our little device trial that we did for the device, the average pain score was a 4 that they gave this procedure.
That's interesting.
And
yeah,
that was without Pronox because we did not use Pronox in the trial at all. So as I said, most of the time we find with proper numbing and proper technique, it's really tolerable. That being said, I want you to be comfortable. So I have Pronox. I'm trained in using Pronox. My other providers are trained in Pronox. So if you would like to use Pronox because you feel like a little spicier than you wanted it to be, like I'm happy to use Pronox. That being said, we do about 90% of them without Pronox because it's such a comfortable procedure, especially again with thinner microneedles, with insulated microneedle, with fast deploy and retraction time,
Yeah.
that really the majority of people don't need it at all.
So I totally agree with you. We have a really fantastic top-notch device as well. I'm not going to go into the needle design, but it's very well designed and very well controlled. But we have found that most people don't need that either. So Pronox is a self-administered nitrous oxide device that gives you basically laughing gas the way you have laughing gas at the dentist. But this is self-administered, so you're kind of giving it to yourself. And people love it. It's kind of amazing. I don't like it at all myself. I don't use it, but I think the main issue for people is their pain tolerance. So most people tolerate this just fine. Most people find it like, it's a little prickly, it's a little heat, it's not too bad, it's tolerable. Yeah, you're good. We do have a very strong topical numbing cream that we use that makes people ridiculously numb. And we actually leave it on for an hour and 15 minutes. And so people are really ridiculously numb. But that said, there are a subset of people who just have a very low pain tolerance and really want the Pronox, and it makes it completely tolerable.
I mean,
So
again, if you're numb and you're comfortable, let's be real. First of all, your experience is better, but then my experience is better as well. So when you say self-administer, for people who don't know, it does not mean you have to push any meds on you. What it means is you have a little mouthpiece and you only get it when you suck on the mouthpiece. It's like a straw, but not. So basically you take it out of your mouth, and then when you feel like you need a little more, you just basically put it in like a vape or something, and you suck on it again.
yeah,
And then you take it out because
yeah,
you self-administered. And for some people who might not know what it means, it just basically means you kind of take a drag or a sip of it
yeah,
whenever you feel like
basically.
a little more. And it is one of those things that like makes you feel kind of loopy, and not loopy like you're gonna pass out and it wears off really fast. But I agree. I don't love it myself because I don't like the feeling of feeling a loopy.
Yeah, me too. I think most doctors are too much of a control freak to like really enjoy being that loopy, but people love it. I have to say, patients love it. So overall, the experience of the treatment's really not bad. For the most part, for us, since we numb you pretty long time, it takes about 2 hours total. And by the time you're done, you're very red and a little bit swollen, little puffy. You can have a little edema in your skin. And what I usually tell people is that if you go home and eat super clean tonight, so maybe a salad and some chicken or something, that swelling will be mostly gone tomorrow. If you go home and have like pizza and beer, you're going to be like a pumpkin tomorrow. So up to you. That pumpkin thing's not dangerous, but definitely adds to the downtime. And then that redness generally goes away over a few days. The longest we see is typically 3 to 5 days. I have found that for the most part, when you do 2 to 3 treatments, the downtime gets easier each time because your fibroblasts are awake. They're working for you. They're ready to go. They're revved up. And you do the treatment again, and it's, oh, yeah, this thing again, no problem. And so the redness and all that, it goes away much faster. So now, like when I do it, pretty much the next day, I'm barely pink at all. Like you can barely tell the next day. And you did mention a while back about these, what some people call track marks, a little dot, right? That's pretty rare. That is really from not real good technique. That's when somebody is going too close to the surface of the skin, whether they're pulling up when the radiofrequency is still going on, or they have the wrong depth, or they're using uninsulated needles. Something's not quite right because those, you shouldn't see those or hardly ever. We do occasionally on a curved surface, like on the jawline. The little tip needs to be flat against the skin so all the needles go in. And if it's curved, it can be hard, although we have lots of techniques where we pull up and go here and then pull down and go there.
Practitioners also will pillow or pull up or
Yeah, so there are
like under the speaker for like when gas to
right.
get it like out.
Lots of techniques to prevent that. So occasionally you might see a couple. Those go away. It's not that big a deal. But the people who are really complaining about it, if you go online, there's a lot of complaints about bad technique. And that's what it's from. And it really should not really be significant as far as if you're getting a good treatment, that's going to be very common.
And I agree that for us, I would say for most people, it's about 2 to 3 days of that redness, that pinkness, little downtime. And we create channels. And the one thing I wanted to mention, and you had mentioned that earlier, is we really are very keen too on people using good post-procedure products. That's a great time to also use some aftercare with some growth factors. Because again, by having those channels, it kind of gets in there. And we do find that when people we use a lot of the like new cutest growth factor aftercare serum, or people use elastin or plated, or the whole idea is if you're using good products with kind of soothing ingredients and aftercare stuff, that makes a huge difference too, again, with how your skin looks 24, 48 hours later.
Exactly. And so we give our patients a little take home kit to use. And we also, besides the products that we typically have in the kit, I'm not really advocating one brand name or other, but I've said in the past on the podcast about just having really high quality medical grade skincare products that actually have what they're supposed to have in it. So that's really important. That can be hard to tell, but hopefully your provider knows what the heck they're doing. They're not just trying to sell you stuff. But yeah, we have started using exosomes as well, the plated exosomes. So I very much am impressed with the results from that. But yeah, so really good skincare at home, avoiding the sun in the first few days, especially. I mean, in general, you should be wearing sunblock every day of your life on any part of your body that you don't want to have signs of aging happen. So in general, you should wear sunblock every day. But yes, you shouldn't get a lot of sun exposure when your skin is still healing from this first few days. Any other recommendations post-procedure?
No, I mean, that's really exactly what we do. I mean, we do tell them that for the first 24 hours, they can, if they feel like there's a lot, they can make themselves like cool compresses with just a little bit of, we have this mixture of doing like a pitcher of water and then some white vinegar if they feel like it's really swollen and edematous to help just for their comfort. But we give post-procedure products. We have clear instructions. They do really well. The other thing that I wanted to mention is that once in a while, we combine it with some topicals that we want to use. So, for example, if somebody has a lot of hyperpigmentation, seeing that we have the deeper channels, we might combine it with hydroquinone or TXA. We've done the same with azelaic acid for bad rosacea. So we're sometimes kind of using the fact that we do have open channels for at least the next 4, 8, however many hours with the delivery of topical products enhance their result.
Yeah, I think that's a great idea. We do that as well. For our listeners, hydroquinone is a common topical medication that decreases brown pigment in the skin. And then TXA is tranexamic acid, which is also really commonly used to treat skin pigment and melasma. And so those are really great additions as well. And then the other recommendation I have really is to use, if you're going to wear makeup, to use a pure mineral makeup if you are going to do that. So before COVID, we used to have Jane Iredale makeup in our clinic because it was, did you? Yeah. So like it was developed originally for dermatology offices post-procedure, and it's the most pure mineral makeup out there. I don't wear any makeup, so I like whatever. But we had it because people would go straight back to work and they would want to put on a foundation, and this was the only thing safe to put on. So we sold a fair amount of that. And then when COVID happened, nobody cared anymore because they're just going home. And now, ever since COVID, they're like, I'll just turn my screen off or I'll just wear a mask. And so we stopped carrying it because people didn't care that much anymore. But okay, for people at home, if you are going to have RF microneedling and you are going to go be professional and go back to work, I would recommend that stuff. The pressed powder is what we used to use, but basically it's pure mineral makeup. Your skin will not absorb it. And so it will not do any damage. I have to say you have to be really careful, whatever your provider says to put on your skin, that's what you should use, because I have seen people put stuff on at home that they had in the medicine cabinet, and I've seen rip-roaring rashes and acne from that. And like the worst acne I've seen was from MAC makeup right after. And then the worst rash I ever saw was just from some oil of Olay night cream that this lady used. And I was just like, oh my God. And it's stuff where if your skin is intact and your barrier is intact, then you won't absorb it. You won't get that reaction. If you've used it for years, no big deal, right? But when you have had this procedure and your skin's kind of open and porous, and whatever you put on your skin's going to get absorbed really quickly, then you really want to be careful about what you're putting on there.
We give them as the option too, because we recommend the Ulta MD. They have a really nice tinted moisturizer that's post-procedure.
Yeah.
That's actually what I wear every day.
I do too.
I don't wear
Every day.
any makeup. I mean, I do like for this, I like did it up for you, meaning I do like mascara. But I don't wear any foundation myself. So I think that's also the thing. I don't like the feeling of foundation. I mean, I'll do it for a month and whatever, but on a daily thing, I use the tinted Ulta MD, and I love that you do that too.
I do. I will say, so never in my life have I worn makeup. No, whatever. This is my 56-year-old face.
But I offer that the patients. We say, would you like to have the clear sunscreen, or would you like to have the tinted sunscreen? And then we literally tell them to only wear that for the next 3 to 5 days. Just like, you know what, for the next 3 to 5 days, skip your makeup, just wear this tinted sunscreen. And that's also the goal. We feel like as people's skin like improves and looks more beautiful, like the amount of times we hear that, oh my God, all I wear now is this tinted sunscreen or this light foundation, because really, let's be real. I mean, I'm not a makeup wearer and I'm not judging anybody, but I do see that a lot of people that don't love the imperfections of the skin really use lots of makeup to cover it up because they don't love their brown spots, they don't love their veins, they don't love their this, that, and the other. And I've heard it so many times that once, especially after IPLs, after laser vein treatments, after all these things, even these treatments, that people think like their own skin is so much more glowing and radiant, and they see the need for less and less to cover up makeup.
And I tell people, like, my goal is to help you like not feel like you need makeup anymore, because it doesn't mean you can't wear it, but
If
you
you
won't feel like you need to leave the house, right? There's just one more thing I want to ask you before we wrap up here, and that is, have you seen any major complications from RF microneedling? And if so, what ones have you seen, and what can you do about them?
Yes, in our practice, and I'm keeping my fingers crossed again, I think with good patient selection, good aftercare instruction, good up-to-date equipment too, and as well like good and ongoing provider training, we have not had any burns, we have not had any mens, which is that skin necrosis, we have not had any blistering, whatever. Now, we have had some like superficial skin infections when people are picker. So the only few like little infections we've gotten are people that literally couldn't help themselves but pick. And so that has been the extent of complications that we've seen. When we talk about what are overall the complications of radiofrequency microneedling, I mean, I think we've kind of brought them all up again. Is of course your whole podcast focuses on going to places, of course, that are licensed and know what they're doing. So everybody should always use an approved device. They should have approved training. They should never, ever reuse their hand pieces, because again, then that is just a nidus for infection. And,
there was one. So for most of these devices, they use a sterile needle tip every time you get a new sterile needle tip.
Comes out of
and I've been doing RF microneedling for almost 10 years. But one person I hired a long time ago, one of my first employees, told me that the previous place where she went, the person was just quote unquote sterilizing the needle tip in like alcohol or something, which to me is frightening, because first of all, the needle's dull. I mean, once you use it, you got to throw it away, but they're covered in blood products. Okay. I mean, you could spread disease, infection, HIV with that. No, absolutely not. So you want to go to a place that's not doing that. Maybe even watch them open their brand new sterile tip when you have the procedure, or at least make sure they do that the first time. But I can't even fathom reusing a tip.
Yeah, so
Um,
I guess I just wanted to bring that up because of the target of your podcast also. So again, obviously use a sterile tip. I mean, I think enough, some of the side effects that have been discussed on the internet that we see with other devices or not so good technique is exactly what you've mentioned, what I've mentioned, the fact that you can get some superficial burns on the skin because either they're using an uninsulated tip or they don't get a proper insertion. So the radio frequency is deployed too close to the outside of the skin.
mhm.
People have had permanent hyper or hypopigmentation, again, from the insertion marks of the needle for very similar reasons. And then another interesting study that I read that I wanted to bring up there is that apparently like nickel and gold allergies are related. So some of the gold plated uninsulated devices, you might also get a more inflammatory reactions if people have an existing nickel allergy because there's some studies where they thought that they were basically related so that one of the reasons people from those marks also get inflammation could be because they're having an increased inflammatory reaction to the actual gold of the insertion tip. Now, I don't know how well substantiated that was. I just thought that was
Oh,
really
that's interesting. I
cool.
wasn't even aware that there were any devices that used a gold tip.
Lots of them
Yeah,
actually will do
they
gold
do.
plated. Yeah. There's a
Interesting.
lot of
Okay.
gold plated tips and gold and nickel allergies apparently go together. Like we know about nickel allergies. So that
Yeah.
some of that hyperpigmentation theoretically could also be that because if somebody has a nickel allergy and reacts to the gold, that you're getting
Right.
increased inflammation and increased inflammation through the healing could leave you permanent marks. And then of course with
Yeah.
certain devices that neither you or I love, because again, we're not having the impedance monitoring, we're not having the insulated tip, you can go way too deep and then have that permanent fat atrophy.
Yeah. I have not seen that in my practice. I also haven't seen any permanent hyper or
I have seen it
hypopigmentation.
from
Have you?
somewhere else,
From
yeah,
other
where
places?
they
I
basically came and said, "Can you fix this?"
Oh, wow. Yeah. I have seen in my practice, so we've done thousands of patients, and I have seen, I believe, about 5 cases of a transient hyperpig in all, let's see, everyone was Asian. Nobody who was darker skinned, just like medium skin Asian. And I don't I it's we actually do pre-treat patients who have medium to darker skin, and we could talk about pre-treatment protocols maybe another time. That's like a whole other topic. But if you do have darker skin and you're going to have any kind of energy-based treatment, then we generally pre-treat you so that your skin doesn't react and hyperpigment. It's really rare with this device anyway because our treatments are not really near the melanocytes, the cells that make pigment. So we're really not stimulating that. But I've seen maybe 5 cases total in the last 10 years out of many thousands. And that's been temporary, transient. It came and went while the skin was healing. It does freak people out, but it requires some topicals that make that go away, and that's been okay. The only other thing that I've ever seen is twice in my practice now, and this is not just with RF microneedling, but occasionally people will have a response to the topical anesthetic
Oh,
and
yeah.
their skin gets super red, and that has happened, I believe, twice in 10 years for us. And then it's numb. It works. It's numb, but then the skin tends to blister and not be happy. And unless somebody already knows they have that allergy, then it's really hard to know that's going to happen.
Right,
That's
I have seen
extremely rare.
mhm. I've seen that
Yeah.
one. We've seen that on one patient, yeah.
Yeah. And in the end, there was no permanent harm from that either, but there was definitely more sloughing of the skin than we typically see.
Yeah.
Well, so this has been a really great discussion. We've gone super duper in depth on RF microneedling. I hope this has been informative for people. I think that this is a procedure that we're both super passionate about, and we just think this is the be all and end all of aesthetic procedures. But I think in summary, right, it will actually thicken and tighten your skin. It builds collagen. It is great for kind of reversing much of what we see as the signs of aging. And it's very safe and very safe on any skin type. And so, yeah, as Judith said a little bit ago, like, I think everybody needs microneedling sooner or later anyway.
Yeah, I mean, I think you gave a great summary of all the things we love about it. And people, if you follow us for the next couple of years, you will see us hardly age. And it's because you now know our stuff.
Well, let's hope. Let's hope. So if you are interested in more information about either one of us or about this podcast or my book, Med Spa Mayhem, you can check out the website. I will have links to Dr. Borger's, both her websites and any other information to all this stuff on the show notes. So you can check out the show note. And hopefully we can talk about another passionate topic sometime soon.
Would love to. Thank you so much for having me.
Well, thanks so much for being here. If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website, medspamayhem.com. And read the book. Med Spa Mayhem is available everywhere books are sold. Thanks for listening. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. Med Spa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.